Okay, so here's a picture of the AVM, the arteriovenous malformations that we just talked about. So the top picture shows you the normal capillary bed on the left, where you can see the artery coming in. You can see a distinct capillary bed and the veins on the right. So remember, those arteries are carrying oxygenated blood under higher blood pressure, and the veins that are blue here are carrying deoxygenated blood under lower blood pressure, right? So now you have on the right the AVM, and that's showing you kind of a tangled mess. There's no distinct capillary, so there's no kind of clean transition from one type of vessel to the other. So you could have a significant drop in blood pressure from one to the other, and it's not gradual, and that can cause those AVMs, which are those kind of unique type of strokes. We also have a TIA, which is transient ischemic attack. The big word here is transient, meaning temporary. So TIAs, they resemble a stroke, which means that the blood supply to the brain is temporarily interrupted and then it resolves. So any of the patient's neurological dysfunction is gone within 24 hours. So it is temporary, and that's the big difference here between TIAs and a full-blown stroke. It's a huge, of course, TIAs are a big indicator of a future full-on stroke. So once you have a TIA, the medical team is all over you to make significant changes in your diet and your exercise and all sorts of behavior modifications, because it's highly likely that you are at great risk for a big stroke. Some people use the word kind of mini stroke or small stroke, and it's really a big warning shot for patients. But I did put in here a little visual just so you can see the difference between a TIA where, maybe that plaque temporarily blocks the vessel, and then all of a sudden the plaque moves through and is, it no longer causes any more problems at this time. So there's a kind of a temporary blockage of blood flow to the area of a certain area of the brain. You see some symptoms, and then those resolve within 24 hours, versus a stroke where the damage remains. So the medical intervention for CVAs, what happens to a patient who shows up at the ER emergently. So usually what's done is an immediate CT scan in the emergency department, because the medical team needs to know the cause of your particular stroke. Is it ischemic in nature? Because you're going to attack that differently than if it's hemorrhagic in nature. So what's causing this, this stroke? Is it a blood clot? Is it a blown vessel? Usually they can diagnose ischemic events within 2 to 6 hours. And I just included here a picture of the scan, of a CT scan of a patient who has had a left middle cerebral artery stroke. And that arrow kind of shows that location of the stroke, just so you can see that. So the medical intervention, of course, the cause is going to drive the intervention. So for folks who are having an ischemic stroke, if they have to meet certain criteria, they have to generally arrive at the ER within 4.5 hours. They may be given a special drug called TPA, which is tissue plasminogen activator. It's kind of like a super clot busting drug. And it can dissolve the clot and increase circulation, and therefore decreases any neurological damage to the brain. Unfortunately, only about 25% of patients get to the hospital in time within that 4-hour window, roughly the 4-hour window, to receive TPA. And also the medical team you have to arrive, then they have to be able to scan you to see if you in fact are having an ischemic stroke, because if we give you this big super duper clot busting drug and you happen to be having a hemorrhagic stroke, that TPA is just going to cause more bleeding and therefore more damage. So we've got to know, A, what kind of stroke you're having, B, you've got to get to the ER in time. And a lot of folks, don't respond and get to the ER in time. I remember several years ago, my great uncle called me and left a message on my home phone telling me he thought he was having a stroke. Yes, like he had symptoms for like a day or two. Yeah, so people kind of explain things away. They're afraid. They don't recognize the symptoms, which is why there's been a lot more kind of public service announcements about recognizing the signs of stroke. So, of course, we also want further assessment. So the medical team wants to know further assessment of your arteries to make sure the rest of the arteries in your brain are in good shape. Could you have clots elsewhere? So they'll take a look at CTA, which is computerized tomography angiogram, which is looking at the integrity of the other vessels. They could also use an MRA, which is a magnetic resonance angiogram, which is kind of like an MRI for the blood vessels. So they need to kind of attack the immediate issue that you're having, but they also want to assess the integrity of the remaining vessels. Are those intact? Are those all also at risk? Okay, I'm going to